you all to today's Facebook virtual panel, and a warm welcome to my esteemed colleagues who will join us in just a little bit. Thank you for agreeing to be part of our discussion today on systemic racism, medical mistrust, and the COVID-19 vaccine. Sheryl, Elias, and Scott, I have the pleasure of introducing you. Your backgrounds are incredibly diverse, not just personally, but professionally as well. And that's why you were strategically chosen for today's discussion. So we're excited to tap into your individual and collective brilliance and expertise. I am Dr. Marcelle Davis, the Director of Diversity, Equity, and Inclusion here at VCU Health System, where we are focused on promoting and advancing DEI throughout the health system and the communities we serve. And we ensure that everything we do, say, and touch is done so with equity at its core. Selfishly, I have to admit that I have the pleasure of working very closely with each of these amazing leaders who are with me today. And I'll share a little bit about them and their backgrounds. Elias Neujahr is the CEO of the Children's Hospital of Richmond here at VCU, or CHOR, as we fondly refer to it. Elias has been in his role since 2017 and has spent a large part of his career at well-known children's hospitals focusing on the needs of children and their families. He has extensive experience in pediatric clinical program development, quality improvement, and master facilities planning, coupled with a commitment to community partnerships and the patient experience. Prior to joining VCU, Elias served as president of the Children's Hospital of San Antonio, an organization that employs more than 170 pediatric providers. There, Elias led successful efforts to significantly improve quality outcomes while supporting operational efficiencies. Elias holds master's degrees in both healthcare and business administration from the University of Colorado. He completed his undergraduate education at Colorado State University, where he received a Bachelor of Science degree in exercise and sport medicine. Elias, welcome.
Good afternoon, everyone. It's good to be with you, my friend.
Thank you so much, Elias. Sheryl Garland is the Chief of Health Impact at VCU Health System. In her role, Sheryl is responsible for building programs and partnerships to improve the health of populations with a focus on underprivileged and minority communities served by our health system. Prior to this appointment, Sheryl served in various leadership roles, including but not limited to Vice President for Health Policy and Community Relations, Vice President for Community Outreach, and Director of Ambulatory Care Services. Sheryl has also had responsibilities outside of the health system and has been the recipient of many awards, including but not limited to the VCU Presidential Award for Community Multicultural Enrichment and the VCU MCV School of Medicine Dean's Award for Community Service. Sheryl is a proud native Richmonder. Sheryl, welcome to our discussion today.
Thank you so much. I'm so glad to be joining you and my fellow panelists.
Thank you, Sheryl. Scott Burnette is the CEO of VCU Health System's Community Memorial Hospital, or CMH, as we fondly refer to it. CMH is in South Hill, Virginia. Scott has been in his role since March of 1999, and during his tenure, CMH has received national recognition for its initiatives in patient safety, quality, and patient satisfaction. Scott has over 38 years of experience in healthcare administration and operations. He has been very active in federal and state legislative advocacy, representing the concerns of healthcare organizations, and has served 10 years on the board of Virginia Hospital and Healthcare Association, where he also filled the role of chairman on that board. Scott was appointed by former Governor Warner to the Virginia Board of Health in 2004, reappointed by Governor Kane in 2008, and served until 2010, where he was approached by Dr. Bill Hazel Secretary of Health and Human Resources of Virginia, to serve on the Virginia Health Reform Initiative Advisory Council. Say that fast 10 times. He also served on Lieutenant Governor Ralph Northam's task force on healthcare quality and payment reform. He is currently serving as a board member and treasurer for the Virginia Health Catalyst. Scott received his master's degree in health administration from the VCU Medical College of Virginia in 1983 and is a fellow in the American College of Healthcare Executives. Scott, welcome to our discussion today.
Thank you. It's an honor to be here, and I very much appreciate the invitation.
Thank you all so much. So I'd like to take just a few minutes to walk us through the format for today's discussion. We prepared a few questions ahead of time to get our conversation started, and if anyone in our virtual audience has additional questions, please type them into the comments section throughout the event, and we'll try to address those questions during the Q&A. So let's get going. Colleagues, your roles are very different, which means you have different audiences. Elias, you're CEO for Chores, so you work with our children and their families. Sheryl, you are our Chief of Health Impact, so your work is focused on ensuring that we meet the needs of the communities we serve. And Scott, you're CEO for our Community Memorial Hospital. So how do each of you define systemic racism, and how have you seen it show up in healthcare? Scott, not to put you on the spot, but would you like to go first?
Sure, I'd be happy to. I will say I've been around long enough to have seen systemic racism, I think, change, at least in my career. When I first was thinking about this, I thought about the days when you would go into a facility and there was segregation. I mean, it was explicit segregation, separate waiting rooms, separate policy. Expectations of people were different. And that's what I initially thought of as systemic racism. As over the years, I've evolved, and especially in this last year, I've really evolved and done a lot more self-searching. And what I've found is it may not be overt racism, but more covert, and that people perceive things that that we may not. And we assume people think like us, and that people, they have our experiences, they have our background. So why aren't, we just assume that's the way it should be. And by not being aware and not being sensitive to how other people will perceive what we're doing, that to me, that is systemic racism.
Scott, thank you so much for sharing that. Sheryl, would you like to go next?
Sure. It's sort of hard to follow up on Scott's example, but I'll try. When I think about systemic racism, I really think about it as racism, as Scott mentioned, whether it's covert or overt, being integrated or ingrained into the policies and the systems and the culture of an organization. And it grows over time. Hard to pinpoint exactly when it may have entered or how it grew, but it's there. And then it becomes part of the norm. And it's even hard to rationalize why you do something. It's just the way it's been done. And I've seen it in healthcare in multiple ways, but I'll give a specific example. As you mentioned, Marcelle, I am a native Richmonder. And so my history with VCU Health System really did not start until I was an adult, and mainly because my parents had such a terrible experience growing up with our organization. Both of my parents were born at St. Philip Hospital, but my father made a decision that we would never come here for care as long as he had access to insurance. Because when he was a child, he did not have positive experiences, nor did his parents. And so one prime example of how it shows up in healthcare, when I did come here, after years of trying to figure out what was going on, that made it so I couldn't come to that place up on the hill, I recall my father telling me stories about when he was a child that they could not get an appointment. They'd have to come down to the 80 Williams Clinic, put their name on the roster, hope that they got called before lunch. If not, go out in the courtyard, eat their lunch because there was no restaurant they could go into. then come back and wait to be called in the afternoon. And so when I became director of ambulatory care, the first question I asked the team was, what does the appointment scheduling look like? And they said, people show up, put their name on a roster, and wait to be called. And that was 50 years later. And what was very disturbing about it is the clinics in which this policy, which had been in place, I don't know how long before my father started coming, were primarily servicing uninsured, underinsured people of color. So for me, that was systemic racism that rolled over into also some issues related to economic disparities.
Wow. Sheryl, thank you for sharing that. I can't imagine just thinking about that history with your parents and now the changes that you've seen over time, how powerful that must be for you. Thank you so much for that. Elias, how about you?
Well, let me first say this. I've had the privilege of getting to know Sheryl and Scott, over my few years here, and to be with both of them, on this platform with all of you is very special. And Sheryl, to hear your personal story and to see the good work you're doing, I want to give a different angle that builds on that with how I see systemic racism impacting healthcare. And it's through the eyes of our providers, through our teams, through our families. We are very proud. I'm very proud that our children's hospital serves all kids. And we're advocates and we're committed to that. And we fight for the underserved. Our faculty, our nurses, our teams, if you spend any moment with them, you'll get that sense. And yet, for many who've had to grow up, Sheryl, as you described, with similar experiences, I have a wonderful physician who is a pediatric specialist who grew up here and shared with me stories about growing up in this community and being concerned about their loved ones in the wrong place at the wrong time, and praying that they would not be arrested, they would not be harmed, there would not be tragedy that could happen. And I'll tell you, those feelings, they strip away at someone like myself who's never had to even ponder something like that. And, this person, and it's a story of many, I'm sure, who have had to experience this, and yet they have the strength and the courage to show up every day and help others and be pure of heart and to fight. And yet what I didn't realize and what I don't realize, and this last year has been very humbling for me. I think I've shared this with the three of you before. There was a lot that was happening beneath the soil that I was not aware of. And so to see all of this, in this last year and well before that, Sheryl, you share your story of 50 plus years ago, and for others, even more than that. I feel so compelled that we have a chance now to do something and to make some good out of this and create that kind of healing. I have privilege that I don't even appreciate or understand. And yet we need to fight for those brilliant minds and those who have so much to offer. And I'm incredibly proud that one of the things we get to do in the children's space is fight for the underserved and create models and programs, working with Sheryl, working with Scott, and what we're trying to do in rural communities to make sure our teams and our families have access to the absolute best. But if our team members are feeling that, that is something that, eats at my heart, because we want to make sure that they have the strength and compassion that they need. So,
Elias, thank you. And many, many thanks to all three of you for your candidness, and for sharing what systemic racism, the definitions, what they are for you. So Elias, you touched on a year ago, right? When systemic racism, those two words really hit the mainstream conversation in literally every home, not just in this country, but around the world, right? Following the brutal murders of George Floyd, Breonna Taylor, and several others. Was that the first time that you openly discussed the role that systemic racism played in healthcare? And if not, when do you recall those conversations beginning? Sheryl, do you mind taking that question first?
Sure. Thank you for asking that question. It's an important one, and it touches on so many aspects of healthcare. And so your question of was it the first time? No. We openly discussed it? No. And do I remember when? I personally got engaged in an open discussion about this. Well, I will tell you, it's been a discussion my entire life. Just by the virtue of where can you go as an African American woman and feel comfortable that you are getting culturally competent and sensitive care. So that's been a lifetime journey. But specifically in my work here, I will tell you the first time that it really became apparent from a professional standpoint was in 1999. So I'm dating myself now. And the reason that it became very important in 1999 is that was the year that we were planning the launch of our Virginia Coordinated Care for the Uninsured program, or VCC. And we went live in 2000. And I will never forget sitting down with a group of over 30 community physicians who were primarily African American physicians, many of whom did not have privileges here, but they were willing community partners, and listening to their perceptions about what it took to get their patients either admitted to our facility or into our specialty clinics. And the specific question that still resonates with me today, because many of those physicians were African Americans who had practices inside of the city of Richmond and served large populations of brown and Black individuals, and hearing their question of, why is it that my patients who may be uninsured and underinsured are given appointments in your resident clinic? What do I need to do to get my patient into a faculty practice? And I will never forget sitting down with our medical director for the VCC and starting on the journey to ask that question inside of the organization in order to make sure that it was understood that there was equity applied when people tried to get access to our facility. And so for me, from a professional standpoint, that's probably the first time that I personally had to deal with the accountability for systemic racism in an institution.
Wow, Sheryl, I can almost put myself in that room because you can remember the year that that happened. It's almost like being right back in that conversation. Thank you for sharing that. Elias, how about you?
Well, on that note, I know very well one of the community pediatricians who was very involved in that, and I call him a friend, Dr. Joe Boatwright III. Very passionate, and he'll remind me we got to get our fingers in the dirt and get them dirty, and he's right about that. So, Sheryl, that's just incredible work and in the right spirit. I think for me, being very open and honest, my moment was a year ago, seeing what happened to George Floyd. And that was unthinkable for me. And yet for so many, they have experienced that for many years in different ways as described here. And I'm sure for our viewers, they've experienced and seen others' tragedies as well. For me, it was an unplanned moment where I was at home and watching the image of this on CNN, and my oldest showed up on my shoulder as this is on TV. And I had an unthinkable moment of trying to explain to my child how something like this can happen. And I remember the gravity of it, thinking, oh my, here we go. And then I think to process that not only with, my children who cannot comprehend that something like that would happen. I cannot breathe. I will tell you, that sentence will mean something different to me for the rest of my life. And so now, fast forward these months of work with our teams, and I'm very proud of our team members in the children's and women's space for rallying around this. And we had, over 75 people give ideas and concepts, and great leadership from key leaders like Janice Roan and David Chelmo and other phenomenal individuals who really coalesced around this and said, we're not going to let this moment go by. And meaningful change and what that means. But for me, in that moment, it was an awakening. And Marcelle, I use that word, very realistically, because this was something that I just could not comprehend. And then I think over the many months and even as real as today, and I call this out, I've had very important recent discussions with individuals, some of our faculty members, the Asian community. I'm thinking of our Asian American community right now. There's some tremendous hate that's happening in that space that is just, so sad and so mind-boggling. And, I think right now what we need, and this is what I believe in, we need a little bit more grace, a little bit more love, a little bit more understanding, a little bit more patience. And for me, it's, all right, Elias, I need to understand and really get into it. And so I'm on a journey, and I still got, Sheryl and Scott will tell you I'm a little slow, so it's going to take me a little bit of time, but this is not going to be a flash in the pan for me. So
Thank you, Elias. I appreciate that. Scott, how about you?
Well, my parents didn't raise me to treat people differently. And even though I'm from the South, I'm from Virginia, my parents always taught me to respect everybody and to speak politely to everybody, and to yes ma'ams and yes sirs. And I know those have all gone by the by now. That's not traditional today. But when I came here, as you mentioned, I've been here 23 years now. I made it very clear that we would not tolerate situations where we had patients saying, I don't want that black nurse in the room, or even use more derogatory terms. I don't want anybody like that taking care of me. There's more than one time I've been in a patient room and said, we will not tolerate that here. And if you don't like the care we hire people by their skills and their talents and their abilities. We don't hire them by the color. If you don't like it, you are welcome to leave. And I have done that in patient rooms more than once. Now, that's been over the years, but I think it became more of a more systemic issue, thinking about systemic racism, again, going back to the George Floyd and last year. And I went back, and I started thinking about this question, it's what I did. I was concerned what I saw going on in the communities out there in the United States, but it wasn't happening here in our community. This community is very unique. We welcome everybody here. So we weren't seeing all this turmoil. But I still didn't think it was something I could ignore. So I reached out to some of the leadership, the people here in this organization I respect, of the minority community, and said, what are you hearing? Are you hearing it from the staff? Are they talking to you? Are there concerns? And from that, we decided we needed to set up a diversity and unity council and get together and start talking about this, even though it wasn't a burning platform for us. It was something, I think, the way we described it was, to not do anything is worse, and to not acknowledge it is worse. And so we started meeting and talking about what we needed to do here and talk about systemic racism, and decided we need to do more towards building awareness within our own community. Our hospital is an internationally staffed hospital. I have nurses and physicians from all around the world here. We have people of all cultures, races. And we decided it's not just a black and white issue, it is all of us together as one team. So we started working on this and having panel discussions like this with our, at lunches, and calling T2, where we were having these conversations and having our staff members share their experiences with racism, even today, and what they experience. I have a home health division, and staff being told, you come in the back door, still today. And hearing those things just shocked me and some of the others that it was still prevalent. So we're in the process of building on that and trying to do more education awareness, but also we want to become more aware of the cultural diversity we have here. And it's been an eye-opening experience for me, and it really has. It's been actually rewarding. because when I first reached out to people, they felt like we don't have that situation here at CMH, but we're experiencing it in the community. And so it made me feel good that we didn't feel like we had it here, but it wasn't something, well, okay, it's not here, let's ignore it then. Let's deal with it and be a leader in this community about it. So.
Thank you, Scott. And your Unity and Diversity Council, I've had the privilege of sitting in on a couple of your discussions, and they're pretty powerful. So thank you for leading that effort. And you all have made tremendous progress. I appreciate that. And I appreciate your transparency in sharing your recollection of when these conversations began for you. Now, Elias, I'd like to turn to you, if I may, and ask a question specific to your role as CEO at our children's hospital, because you work with both our children and their families.
Mhm.
So, how do we start the conversation to help our children? And then what do you say to families on this topic of medical mistrust?
Yeah. So I've thought long and hard about this question. It is an important one because I think the first piece is my acknowledgement, our acknowledgement that medical mistrust is real and why. How have we treated uh, our African American, families over the years? How have we treated persons of color in different backgrounds? And yet, if they come in and they're receiving care, are we truly in tune with what they need? And for the child, it's not just the child, it's the family. And so when they are accessing our system, how do we treat them when they're trying to schedule an appointment? Sheryl, you talked about experiences and approaches in the past, and those got to be in the past. This is a different day, right? This is about how do we make sure all children, including children of color, have access to the very best, the minds, the expertise, the models of care. And so I think acknowledging that mistrust means that we need to make sure we're listening and conversing and trying to understand through their eyes how an experience may feel, whether how they were treated on a phone, how they were treated by a team member, if there was an interaction or there's a question about some type of discovery or care plan. Are we really making sure that we are communicating effectively? Part of the beautiful nature of uniqueness is it's unique. And, I think paying close attention to that and the children feeling that support even with their families is critical. And so, there are many real-time opportunities of this right now. Think about the vaccine and the importance of having great leadership around that. And I think about Sheryl and Rob Wynn, and there's so many different folks who come to mind who have the courage and the wherewithal to say, wait a minute, we need to stand at the front of the line and showcase and demonstrate the safety and the effectiveness and the appropriateness. And I think being mindful of that is very important. And then yet the other piece is there's still discovery, in terms of the mistrust. And I assume for me, perhaps even 2 years ago, I was not aware of that like I should be. And so it's a journey. But I think for kids and families, they are synonymous. We talk about family-centered care all the time in the children's space, and it's real. So.
Thank you, Elias. I appreciate that. Scott, I'd like to turn this next question to you, if I may. Community Memorial Hospital, or CMH, is in rural Virginia. And I'm wondering if you can share with us, what are you seeing with medical mistrust and systemic racism specific to South Hill?
Well, it's interesting. Our name is Community Memorial Hospital. We're here for the community. We were built by this community and contributions from everybody. Starting in 1952, and I always perceived us as being the hospital for everyone. And when I went back and looked at the history, the first baby born at this hospital was African American. The first employee hired were African American, and I was thinking, hey, we're the community hospital. Everybody loves us. And then as our council started meeting together and talking more, I kept hearing more and more, well, that may not be true. We may not be perceived as everybody's hospital for our minority community. So I reached out to a good friend of mine, Bishop John G., who was the head of the RZUA. He was actually the first chaplain I hired here at the hospital. And we had a meeting, we had a conference with some of his pastors. And so I was very candid. Said, this is what I'm hearing. Tell me what is going on. And they were very honest with me, and they said that, we don't think there's anything specific going on, but there is a perception that white people will be treated differently at your hospital than blacks. And he said, there's nothing specific, but there is a perception, and it's based on all of the years of how blacks were treated in this community. And so it's just to assume that if you have a white physician, they're going to treat him just like the white community did out in public. And something that was even really amazing to me was they said, even your foreign physicians, we have a lot of them that were, trained overseas, will interact differently with white patients than they will with black patients. And that's the perception. We don't have any specific information, but that is a perception in our community. They relate better to white people. And so from that, we decided to start working more with our religious groups in this area, our churches and all that, to how do we get past that? And they said, you need to communicate better, through their communities. And they've offered to open up their communications networks to us to be communicating with the community. And especially as Elias talked about the vaccine, how do we get the word out about the vaccine? How do we get people to trust the vaccine and all that? So they're helping us now to deal with that. But it was to know that we're really not perceived as great as I thought we were. We're great, but we still have some work to do.
Going from good to great. Thank you so much, Scott. I appreciate sharing your insight on what you're seeing in South Hill. My next question is about addressing that medical mistrust head on, right, with our patients, because none of us are denying that mistrust exists. So how would you advise our healthcare providers to go about addressing that mistrust? And what are strategies that both we as individuals and we as a health system can use to break down the barrier of mistrust to ensure that we're building trust as opposed to compounding that mistrust? Sheryl, do you mind taking that one first?
Sure. Thank you. Marcelle, again, another important question, and I'm going to build off of some of the things that Elias and Scott have shared, because I do think that there's a common theme that's being developed around this issue across our entire health system. And first is related to listening to the concerns and the issues that are being brought up. As Scott was talking about perceptions, what I've learned is perceptions are often reality in people's experiences and minds. And we need to hear what it is that people have on their minds and not just listen, but really hear it. The second is to make sure that we have facts when we want to provide responses, because our perceptions of how our institutions are responding may actually be different than how some of our policies, systems, and processes are playing out. And that could be a driver of some of those perceptions. The other is to arm ourselves with tools to make us better, to make us more responsive, in order to make us more welcoming and provide a stronger patient experience. And then finally, building off of something that Elias said, and I'm going to take it one step further, Elias mentioned grace. I think we need to have the grace and the space in order to grow, which means, just like what Scott mentioned, we create forums to have the discussions. We're all working in busy organizations, and we've got a goal of making sure people are healthy or helping them on the journey towards being healthy. But it's important, given all of the issues we're dealing with medical mistrust, that we create the grace and the space in order to talk to people and understand how it is that they're perceiving the services that they're receiving, because that's just as important as the clinical care we provide.
Indeed, the grace and the space. Thank you, Sheryl. I like that. Elias,
Well, first of all, any chance I can listen to Sheryl, I'm listening. I mean, she's on it. What you remind me of, Sheryl, with those words, and I'm thinking about this even for me, in this moment, even right now, is being comfortable, being vulnerable. And I think for all of us, me included, the space to be vulnerable and to understand that you don't have to have all the answers. And maybe it is okay to be able to admit that I need to listen more and I need to understand more, and maybe embrace some of those tools, right, Sheryl, that you're talking about, that it can help heal and drive change in a way that is meaningful. And I heard somebody say this, and I do think it is so wise. Enough is enough. And so if we're going to create meaningful change, what does that look like? And I think the grace in the space creates that kind of venue, that field where we can be people and listen and learn from one another. And, along the way, honestly, I think there's also self-growth that happens in that. Certainly, I've experienced that, trying to explain it to my children, supporting our team members, listening to our families, listening to community providers who work with families. They're the quarterbacks of the team, and they may be describing an experience for a family who's trying to access our services. And I might think a telephone call is an easy thing that's going to go right every time. And yet maybe there's a perception that there was racism in that interaction. There was judgment. And that is something that I think for all of us to be aware of, and embracing this notion of diversity, equity, and inclusion. And, building trust, it just doesn't happen. So the grace in the space is the key.
Indeed. Thank you, Elias. I appreciate you expanding on what Sheryl shared. Scott, how about you?
Well, actually, I was wondering how Sheryl got a hold of some of the notes that I had written myself when I was working on this, because one of the first things I had was being transparent about what we're doing and about the things that we're offering here in the community. And I got these actually when I had my great conversation with Bishop G and some of his pastors about that. And they advised being transparent about what's going on at our hospital, and communicating through their organizations, making sure we're getting the communications out into all of the community and not just the local newspaper or the radio station. How do we enhance that? So communicating about what's happening at the hospital and how it affects everybody. And then educating, we're talking about the vaccine, is the vaccine safe and all that, and educating people and acknowledging, some of the history. And we talked a little bit about the Tuskegee experiments that took place I believe it was in the 50s, and the mistrust that helped create. But then Sheryl started off with the word I had, it was listen. Listen to what people have to say, being transparent and asking them questions and being willing to hear what they have to say, even if it's unpleasant, and that if you don't know what you've got, what's wrong, you can't fix it. So that's one of the things I think we need to do. And that's why we're re-energizing our community church partnership. We had at one point 95 churches in our organization, in our partnership. We're rejuvenating that, and I think we've got a lot that's really exciting happening here now that's going to help us going forward.
Scott, thank you for that. One of our audience members, I will share this before my next question, said that she read a quote today that said the word listen contains the same letters as the word silent. That's pretty profound. So I wanted to share that with you. So this next question is about accountability. And that's something that can be difficult for all of us to hold ourselves and each other accountable sometimes, because sometimes it means that we have to take a good hard look at ourselves and each other. And systemic racism is a byproduct of bias, whether conscious or unconscious, right? And yet unconscious bias is something that we all have. We can't deny it. It exists. It doesn't mean that we're sick, but it means we're human, right? So how do each of you hold your teams accountable to ensure that we treat each other equitably and fairly, whether we're going out into the community or seeing patients at any of our locations? Elias, would you like
me to start? Yeah. It's an important question, right? Because it's walking the walk. I think awareness and clarification and not being silent, being clear about why this is important, right? This is not just what, it's why. And, in our space, when we think about kids and families, I want to make sure kids that are in those underserved areas that can't access care What can we do to make sure we're making it easier for them? I think about programs like UCAN and Dr. Schechter and some of that great work. I'm telling you, that work has kept kids in school, learning and growing. The populations that we're serving, you see a preponderance of that, especially in persons of color, which is very important. You think about the work that we are focused on in extending care. We do not make access to appointments based on privilege. Our care is there for every child. And the expertise that we have around that is done in a way to ensure that we can bring our best for every child and family we're caring for. And then I think also too, I take great pride in being a part of a health system that values community and values serving as a safety net institution, because that's what this community needs and deserves. And our great future tomorrows are in those communities. And I heard recently some very good work that's being planned for ensuring that the vaccine can get to those communities that have difficulty getting in a car and driving to a location to access a vaccine, right? Thinking about how we can bring it to them. That is powerful medicine. The virtual world has been another way that I think for us has been powerful in terms of extending our care and making sure we can make it easier for families. But not all families have the ability to access virtual care. So we're really challenging ourselves to think differently around how can we ensure that we are treating all patients fairly and equally. I also think the final piece is we're talking about this, and really talking about it is so important, because that essence of discovery and perspective is going to make sure that we're at our very best.
Agreed, Elias. That open communication is so important to making meaningful change. Scott, would you like to weigh in?
Sure, and I think it goes back to what Elias started with. He said walk the walk, but I say lead by example.
Yeah.
And when we decided to start having the discussions here, I could have assigned it to another individual, say, hey, I want you to work on this, and so, ask the chaplain to lead it or whatever. But I felt it was important enough for me to be at the forefront of this, and I have a great chairperson who's been leading the committee, Ms. Trakisha South, who has been a wonderful leader. But I said, I'm here with you. We plan together for these meetings. We sit in my office and we talk about what the next meetings need to accomplish. And being willing to have those discussions and pushing those discussions forward, I think is what my team here knows. This is important to me. And we could have taken the position, well, that all the racial stuff in the country, you don't hear about it anymore. Let's just forget it, move on. And I don't want this to be the flavor of the day initiative. This needs to be something that's sustained and going forward. And that's why I think I need to be in this for the long haul, and supporting everybody, and then engaging everybody here as much as possible.
Thank you so much, Scott. I appreciate you taking ownership of that work. Sheryl, how about you? Would you like to weigh in on that?
Sure. Our team made a conscious decision when we formed our Division of Community Health that we were going to build as a foundational principle that of health equity. And that is that everyone should have an opportunity to be as healthy as they can be, which means that we as a division, and then we look to our partners across the health system, need to think about what are the things that we need to bring, that we need to do in order to ensure that people can live the healthiest life that they can and have access to the best care that they can. And the fundamental question that I constantly am asking, and that we hold ourselves to, is this the level of care that you want? Is this what you want for your family? Because my mantra is, but by grace, I may be in a different place. And so it is important to think about, as we sit in our positions across the healthcare system, and we think about the opportunities we have to serve people, that this service comes with an obligation and it comes with a responsibility, which means that we need to think about what is it that we would want for ourselves, and that's what we should be offering to those we serve.
Amen. Servant leadership at its best. Sheryl, thank you for that. I have one final question before we jump to questions from our audience. And that question really is more of a call to action for us as individuals. So, what can each of us do to serve, Sheryl, teasing out that thread, and lead from where we are through service and be a part of the change that we really want to see? Scott, would you like to take that first?
Yeah, this is one I've thought about. One of the things that I need to do to be part of the change is still to explore and educate myself. I did some of the unconscious bias training, or not training, but tests and things like that. Just because I thought, well, this is the way I am. But I learned a few things with that. But I need to become more educated in how we can affect change and the perceptions. Not just of what people have of us, but how I might be perceiving things inappropriately. So educating myself is part of that. But then going back to what I said earlier, I need to be at the forefront of this. I need to be leading this, and not let it, as I said, become the flavor of the month initiative. This is something we need to sustain, and then I need to show that I'm behind this, and giving the resources to it in our community. We're in the process of redoing our whole community health and wellness division here, to rethinking how we've been doing it for the last probably 50 years. What do we need to do different? And recognizing some of the things that have been revealed here in our discussion today and over the last few years.
Scott, that's pretty powerful. Thank you for sharing that. Elias, would you like to weigh in?
Well, I want to build on something that Scott was talking about, which is embracing this really special opportunity for self-education. For me, it's got to start within, right? And being on this journey, not just for myself, my family, our team, our caregivers, our families, our community, right? There's so much work that needs to be done and is being done, but more work that needs to be done. And I think about, again, from earlier in our discussion, the power of listening. I think I'm working to become more comfortable with this notion that I have this unconscious bias, and how can I listen and understand? And, I pray that people feel safe, that they can share concerns and perspective and challenge. When the terrible tragedy with George Floyd happened, we had several within the children's, more than several, but folks come forward and say, where do you stand? Elias, where do you stand? Where does your leadership stand? What do you believe in? And what was interesting, and by the way, this wasn't just here in the Children's Hospital, VCU Health, the community, the country, the world, it became, for me, and I think for our team and hopefully our families, this real commitment to being vulnerable and listening and learning and allowing grace and space, but also embracing this notion that there is systemic racism that we have to overcome. And that begins by me standing arm in arm with, my brothers and sisters, and not being silent, because silence is acceptance. And that's something that's very important. I think the final piece is this willingness to look outside of yourself and the value in helping another individual. Right now we're in the midst of one of the most difficult times I can recall, in my 46, years. People deal with stress differently, and and the pain and the suffering that has happened to families, especially those in underserved populations. What can we do to be there and to be supportive? Because they deserve that. So thank you, Marcelle.
Elias, thank you for that.
Yeah.
Sheryl, would you like to weigh in on this question?
So I think Elias and Scott have really covered the watershed of how I would want to answer this question, with one exception, or one additional thing that I'd like to add, which is I do think that the acknowledgement that the world is not right and that there are opportunities for change that are important. And as much as I had hoped that things had changed so significantly from when I was a child growing up in Richmond, Virginia. It hit me like a ton of bricks last year when we began to see the social unrest. And one of the things that I had to do, which is still very difficult for me to deal with, is I called each of my grown children and I apologized to them. And I told them that I was so sorry that I had misled them in believing that the world had really changed from when I was a child. And that I had hoped that they would never have to see the things in their lifetime that I had seen growing up. And so it humbled me because it made me realize that if I really did believe that the world was changing, then I needed to get in the game and that I needed to figure out how to move past my level of comfort because I was believing that things had changed so much, to active engagement in asking the question that both Elias and Scott have put on the table: what is it that I need to do to be a part of the change? And understand that it's a journey. There might not be an endpoint that I see in my lifetime, but there is a role that I need to play.
I told y'all I'm very emotional. Sheryl, wow. I have to say that I've done diversity, equity, and inclusion work for more than 2 decades. And I remember the day and the time of day when I had the talk with my daughter. And she just turned 15 on Monday. So to feel what that conversation must have been like for you with your grown children, I feel that the weight of that emotion, because I carry it too every time my daughter has an experience that may not be equitable or fair, right? So thank you for sharing that. We do have one important question, and I'd like to put it out to my esteemed colleagues, which is, how do you address pain management for African American patients? There is a myth that Blacks have a lower pain threshold. Anyone of you want to take that question first?
I honestly don't have a good answer for that. I know we have a pain management clinic here that serves our whole community, and I see patients of all races coming in here every day. It's actually in the building that I'm in with all of our other clinics, and so I wish I had an intelligent answer for that, but I don't.
Yeah, I don't think I have an intelligent answer for that either. I think that myth, I mean, obviously it's very concerning, and being able to think about how we can learn from that, the conversations at the time of care, really making sure we're being empathetic and listening to concerns and not taking it for granted. And when we're dosing appropriately, right, that we're not exhibiting bias in that calculation. That's a very good question that causes reflection. Maybe Sheryl, you have some great words of insight.
So I think I'd start with the second part of the question. Let's call it what it is. It's a myth.
Yeah.
And so let's acknowledge it. It's a myth. So now let's walk backwards to the question and say, how do you address pain management for people, for all patients? And let's remove the myth.
And maybe one of the things we can do, of a more scientific nature, at least, is going back and doing a search of our patient records and all that for our clinics here, and see, is there a disparity in how we are prescribing for the same diagnoses? Yeah. That takes a little more research and time, but frankly, this is a myth I wasn't aware of, and that just shows my ignorance.
Yeah.
And selfishly, that's one of the things that I have come to embrace in my short time being here at VCU, is that I have not had a conversation with any leader who, when something like this is raised, they shy away from, oh no, that doesn't happen, not us, right? Scott, you literally just said, I wasn't aware of that. What can we do about it? Let's look into that to see if that exists. And so I that's one of the reasons I'm so proud to be here and to work with you all. So thank you for that. We have 4 minutes left. I'd like to ask if any of you have any closing remarks that you'd like to make, any question that you'd like to expand on, something that we didn't cover. Sheryl, would you like to go first?
Oh, thank you. So first of all, I want to thank you for hosting this webinar. It's always a pleasure to spend time with Scott and with Elias. But I think it's even more important when you get to actually share thoughts and ideas that help to support who we are as an organization. It's always important to be able to spend time talking about that. I recently ran across a quote, and I just want to share it with you guys, just in closing as we're thinking about this topic. And it actually was a quote that came from Chadwick Boseman from his commencement speech at Howard in 2018. And I do think it goes to part of this question about systemic racism and what should we do about it. And what he said is, purpose is an essential element of you. It is the reason you are on the planet at this particular time in history. And so today, at this particular time in history, we have been brought together to talk about this very important topic. It's part of our purpose for being on the leadership team in this organization. And I want to thank you and thank my fellow colleagues for being on this journey as we try to address important topics such as systemic racism.
The pleasure is all mine, Ms. Sheryl. Thank you for that. Scott or Elias, either of you want to share any closing remarks?
I'll share one, and it's just something I just wrote a newsletter to our employees. I do one every month, and I don't know that I've ever seen a painting where it was all white and it was beautiful. It was all black and it was beautiful. Every painting I ever thought was beautiful was a collage or a mesh of just everything coming together into a beautiful picture. And that's what I talk about with my team here. The talents, the diversity we each have, our talents, our backgrounds, our races, our ethnicities, our cultures, coming together, and what we do at our organization to heal people here, to take care of people. It is a beautiful work of art. And I can't imagine if it was just one race or one ethnicity or one culture. If we didn't have this blend here, we wouldn't have the great organization we have. And that's what I look at it. This is a work of art here. And that's what we need to embrace and appreciate. And I thank you, because if you think about diversity, you look at me, I am exactly a poster child of diversity. I am what most people don't think of. So I thank you for the opportunity to be here today.
Of course, it's my pleasure, Scott. Elias?
Well, I want to say Scott is onto something. Our differences make us stronger. And Marcelle, I want to thank you for your leadership. You're an amazing human being. And every time I'm with you having a conversation, it just feels a safe place to be able to introspect and dig and understand and learn. And so I want to thank you for that. I want to thank Sheryl and Scott, two great human beings, great leaders, but even better people. The chance to be a part of something like this, I'm very humbled by this because, I'm a novice in this space. But I think there's one piece that I think about, and that is we're going to do some good out of this. And y'all know me, I'm an optimist. That's how I was born. And I just believe that out of this pain and suffering and introspection and courage and honesty and hope, that conversations, Sheryl, like you talked about with your children who are grown, I just think about what that could look like in 20 years from now. And Lord knows I want to do everything I can to help. And so I'm just honored and humbled to be here. So thank you.
Wow, many thanks to each of you for your transparency, your authenticity, and your candidness. Grace and space. That's what I want to take away from this, that we give each other the grace and the space to learn and grow and think and serve. And so thank you for the time that you all dedicated to me today, to this discussion, and for your work in this space. I'm so appreciative. If anyone needs to reach out to me, I am at marcelle.davis@vcuhealth.org. Thank you all so much and have a blessed day.
Bye-bye.